Hello, everyone. A very warm welcome to another exciting episode of Psychology Talks. And today we're going to discuss a very interesting topic. And I've been actually looking for this episode for quite some time because this topic is kind of very intriguing because, like, it's about role of psychedelics in the use of like therapy. Psychedelics have been like a very controversial topic as these are the drugs or these are maybe the herbs that has this some kind of capacity to alter the perception and I can actually trace back its roots to some ancient history as well because there's some in ancient history people used to use these kind of psychedelic herbs to induce certain kind of experiences, certain kind of dreams, certain kinds of spirituality. So I was looking forward to this one. But in present times, these psychedelics are used to treat some mental health problems like PTSD, depressions, and anxiety. Uh, so that's why we have a very esteemed guest today, and his name is Dr. Will van Derveer. He is a pioneering psychiatrist who became discouraged by the conventional mental health care, and that's when where he was trained to provide. But after 2 decades of developing innovative approaches to address the root cause of symptoms, in 2018, he co founded the Integrative Psychiatry Institute, and he's on the mission to transform mental health care. Will set goal to train 10,000 providers in psychedelic assisted therapy and other innovative innovations by 2028. So, and today he has actually empowered so many hundreds already. So let's welcome Will. Hello, Will. Thank you so much for joining us today.
Thank you so much for having me. I've been looking forward to this.
Yeah, me too. So I'd actually given a very short, very brief introduction about you. So, and I've actually read a bit about your story as well. So tell us a bit about yourself, that how you ended up having these psychedelic drugs or psychedelic treatment into mental health.
Well, I was trained originally traditionally as a physician, medical school, psychiatry training, and it turned out that the tools that I learned how to use just didn't help enough people. We know now from very large research studies that about one third of people who receive conventional treatment for depression, for example,
Mhm.
get almost no benefit from the conventional care.
Yeah.
And then we have one third of people who do receive significant benefit, which is wonderful. But then there's another third who get some benefit, but not enough benefit. So the current treatments are very disappointing for many people.
Yeah.
So that led me to look for ways to try to address root causes. And one of the biggest ones that we miss in mental health is trauma. So what we see with these tools, this new, as you said, they're not new tools globally, but they're new tools for Western culture or modern culture. Um, is an incredible opportunity to get deep into the psychology of the suffering person and help them actually begin to unravel and resolve what's deep inside of them.
Yeah, yeah. I mean, that's very true because especially for PTSD and other like of mental disorders, uh, sometimes therapies do not work, and I think some medical intervention is also needed. But at the end of the day, some what I've seen is that medical intervention also make them kind of dependent on the drugs and dependent on the medication. So do you think so these psychedelic drugs are also, I mean, they have to use it for the entire lifetime, or is it just that like they need to use it for a certain time and then they get cured?
It's a great question. I mean, that to me is one of the biggest benefits of psychedelic therapy is that you, in the research studies that we've seen up to this point, you have very long lasting benefits from only a few drug experiences. And for example, in the research I was involved in around PTSD we were treating people with MDMA assisted therapy with chronic PTSD. The protocol involved only receiving MDMA 3 times. And at the 1 year follow up, about 3/4 of people still didn't meet criteria for PTSD. So the goal here is to minimize the reliance on medication and get the maximum benefit. Oh, I lost your volume.
Oops, sorry. I
Here you
think
are.
I was on it. So yeah, I know that we have started this discussion on psychedelic, but let's actually educate our audience first that what is psychedelic, because a lot of people actually do not know that what are psychedelics and how psychedelics differ from normal medication.
That's a great question. So psychedelics, I think broadly defined, the best definition is what you said earlier is they alter consciousness. So they cause a person to enter a much wider perspective, a much more open psychological state. People become very much more connected with what we ordinarily would think of as being outside of our sense of an isolated self.
Mhm.
In some of the spiritual traditions around the world, of course, there are teachings around the isolated self versus the universal self, or
Mhm.
the feeling of oneness with the universe or with
Yeah.
God, for example. So one of the big changes that often happen in this altered state is a sense of connection that people often can feel very isolated when they're depressed or they have PTSD or they have other mental health challenges. So going into an altered state is a very tender and vulnerable choice to make.
Mhm.
It's an act of courage for many people to let go of our ordinary way of interacting with the world, and so it needs to be protected very carefully. And
Yeah.
that's why it's so important to me that therapists who are interested in getting into this work get really excellent training, because it is a little different from ordinary therapy.
Yeah. So my next question is that how it actually altered the consciousness. I mean, I know it's a very deep questions, or maybe like it requires like a lot of time to explain, but I know that if you can briefly summarize it, what happens, does it like play with some neurotransmitters, or what exactly does it do?
That's a great question. So the pharmacology experts will tell you that a classical psychedelic uh, interacts with the 5-HT2A receptor, which is in the cortex.
Hmm.
And we know that when I say classical psychedelics, I'm talking about LSD, psilocybin, um, DMT, which is the active
Yeah.
ingredient in the Amazonian brew ayahuasca.
Hmm.
But there are other psychedelics like MDMA and ketamine, for example, that don't interact with the 5-HT2A receptor. So
Hmm.
that's why I say that I like the broad sort of experiential definition of an altered state of consciousness, because the 5-HT2A receptor is not necessarily involved in this change in consciousness. Another interesting neurological finding in the altered state is changes in what we call the default mode network. So,
Hmm.
default mode network is a network of hubs of information in the brain that represent ordinary consciousness and how we think about our experience all the time. So, the best example is when you're in the airport and you get to the gate, and then you suddenly find out that the plane is delayed.
Hmm.
And what does your mind do in that moment? It starts going through the list of things that, oh, I didn't send that email to that person. Oh, I forgot to do this. At least that's what my brain does. And that represents the default mode network kicking in. So the default mode means daydreaming. For people with depression, default mode network involves rumination. So it's a more extreme version of daydreaming that tends to be negative and self-referential. So what happens with the default mode network on psychedelics across the board is that it opens up, it becomes softer.
Hmm.
And you can also see this phenomenon in people who meditate every day for decades, that the
Hmm.
default mode network electrical pattern in the brain is more open, it's more flexible. And so that's another way to measure, what's a psychedelic, something that opens up that way of thinking, and provides an opportunity to interpret your experience in a different way.
Yeah, I mean that's actually very fascinating. That how can a drug do that? Like especially to alter the consciousness. Like I've been going through some kind of some literature on psychedelics, that how it actually not only calms down the mind, but it also, as we discussed earlier, that it alters the state of consciousness. Like people may start seeing some kind of hallucination, start having some hearing those different voices or something. So, how do you explain this? I mean, uh, do you think that it is? I mean, it's again a very deep question. That do you think that it's basically connect to the person to another kind of level of consciousness, or it's just causes some abnormality?
That's a great question. I think that's very much up for interpretation.
Yeah.
The pieces that are more interesting to me when I am the psychedelic therapist in the room and I'm supporting someone on a psychedelic experience are the elements of material from the person's unconscious mind that come forward that present themselves for healing. I'm not as interested in whether they're seeing hallucinations or hearing things. That might be. I would probably chalk that up as some kind of electrical firing in the brain that is not as relevant to the experience. But the opportunity is when people begin to realize that when, let's say, the primary caregiver who loved them and took care of them, who died suddenly,
Mm-hmm.
that the grief wasn't complete in that experience. And they can oftentimes people will connect with pieces from their past that haven't been completely integrated or digested.
Mm-hmm.
And that can really help people unburden themselves and move forward in their lives.
Okay. Yeah. So, I mean, yeah, that's very interesting. So, I was also going through your website. You basically it's about the like you talk about nutrition, and it's I think all you treat with people you treat people with herbals, right? The herbs or natural psychedelics instead of having these allopathic medicines, which is like more like it's made. So, what is again the difference between the herbal psychedelics and the normal ones?
That's a great question. You have really wonderful questions.
Thank
Uh,
you.
I asked one of my mentors that same question about 10 years ago, and he said that he quoted Albert Hoffman. Albert Hoffman was the German, or sorry, I think he was Swiss chemist
Mhm,
who accidentally invented LSD.
mhm,
Dr. Hoffman said that, it's not the phenomenon of, or the experience of the psychedelic state is not different, whether it's herbal or manufactured in a pharmaceutical environment.
mhm,
Um, I will say that the set and setting is something we talk about a lot, does matter quite a bit. And for example, there are, in addition to historical examples, there are present day examples of
mhm,
indigenous communities that use psychedelic medicines, plant medicines,
mhm,
herbals, as you said, in a very specific way with specific rituals and cultural traditions and songs and prayers and so on that hold the experience in a unique way, where the chemical effect of the plant is not considered to be central to the healing process. It's considered to be a sacred ally in the healing
mhm,
process. But the ritual itself and the songs and the prayers are, if anything, as important, if not more important. So it's interesting to think about, what's actually um, what's actually moving the consciousness in those moments. I had the opportunity one time to go and study with a shaman in Brazil
mhm.
who didn't work with plant medicine. He was not involved with psychedelics at all,
Okay.
but he ran a very specific kind of ritual that
Mhm.
involved water offerings, candles, prayers, songs, um, dancing. And
Mhm.
his community, I was with maybe half a dozen Americans, and all of us had psychedelic experiences in the space with no psychedelic compound consumed. It's very interesting, right?
Yeah. Yeah, actually, that is why I was very much interested in psychedelics. I mean, I did not research more on that, but of course, it's very fascinating because how these, I mean, just consuming these maybe herbs or plants or whatever, it changes the entire estate, right? And as you mentioned, that like it can be induced without having these drugs or medicine or these like whatever you want to eat, like especially the herbs or whatever. But it is like, okay, so my next question is like, I can go on and on this topic if I go in detail. So the other, like, I'm very much interested in it's because in ancient time it is also often like used, these kind of especially herbs used in inducing certain dream-like state, right? Because again, dream escape used to be and is still in certain kind of communities, religions, or some kind of is considered to be a sacred space, and this usually people use to connect with maybe God or whatever. So, what psychedelics are used to induce that kind of experience of dream escape?
Well, I would say that you could characterize, and it's been done, and I think it makes sense that the people, it historically in psychotherapy, I don't consider myself to be a Freudian, but there were a few things that Freud said that I do resonate with. And one of them was that the dreams are the royal road to the unconscious.
Yes.
And so a dream state, whether it's something that happens when you're sleeping or it's something that's induced by an herbal psychedelic, um, can provide information that's really helpful for healing. So I would say that any of the psychedelic compound, I don't think of one of them as being particularly uh, oriented toward a dream state. It could be, we might say ketamine might be one of the opportunities for that because of its dissociative quality, which is kind of unique and different about ketamine.
Hmm. All right. So, okay, I mean, it's you mentioned that it's usually used in depression, PTSD, or something. So, like, uh, I want to ask that how, like, for example, especially if we talk about the PTSD, it's very hard to actually cure in normal circumstances because it takes a lot of, it's a lengthy process. And um, sometimes, usually even sometimes patient is in the danger of like, going back into the drama again and again. So um, I want to ask that how these psychedelics work, especially in PTSD cases. Does it lower the anxiety or something, or is just help them understand their situation? So how does it work, especially when you're dealing with PTSD or these kind of patients?
Well, with PTSD, I 100% agree with you. It can be really difficult to treat. I've had people in my practice who struggled for years, I mean, decades with symptoms. And the study that I was involved in deeply, using MDMA therapy for PTSD, the average amount of years that people had been suffering PTSD was 29 and a half years.
Oh my God.
So these people had been sick for a very long time,
Hmm.
and many of them had had dozens, hundreds. In one case, we had a person who had had over 1,000 therapy sessions
Oh.
coming into the study. So,
Hmm.
and this was the group that, at the 12-month follow-up, three-quarters of them still didn't meet criteria for PTSD.
Hmm.
So it's it can be incredibly difficult and frustrating for therapists to
Yeah.
sit in the chair, week in and week out with people who are, as you said, they're going back into experiencing the trauma. They're getting flooded by their symptoms. They may have suicidal ideation. That's all, 24/7. So what was really interesting for me to learn about as I became trained and provided MDMA therapy was that there is a strong increase in the hormone oxytocin that comes from MDMA.
Mm-hmm.
Oxytocin is a social connection hormone, and it also has receptors in the amygdala, which, of course, the
Mm-hmm.
amygdala is very involved in fight or flight response and self protection and fear. So, what I saw happen with clients on MDMA was that they had less fear. And so there was less flooding as they were able to engage with traumatic memories. And with the oxytocin, there was more trust in the therapist.
Mm-hmm.
I've worked with clients with PTSD where it takes a year to get to where the person can trust enough
Yeah.
to talk about their difficult traumas. But with the MDMA protocol, these people were signing up for a study where they only got to meet with the therapist 3 or 4 times before they took MDMA.
Oh.
And the level of trust that they could have in the session was quite incredible. Even to the point where after the MDMA wore off, they were kind of feeling pretty uncomfortable about how much they revealed to the therapist during the session.
Oh.
So having a compound that can uh, produce such a big result in a 5-month protocol
Mm-hmm.
versus having someone try and fail and try and fail to get
Mm-hmm.
well over decades is a pretty exciting opportunity.
Yeah, I think that's why I think it is very important that, um, but again, as you said, that like psychedelics should be used by a trained practitioner. So they can actually guide the patients to use it in a right way, and they can be treated much faster. So another thing that I want to ask is about the neurodiversity, because there are lots of people who have been like it was not as like people were not aware of these things, like especially neurodiversity, ADHD, autism, and lots of other neurodiverse situations, the problems. So does it really help in those situations as well with those issues, or it's not very effective there?
Well, what we do know about psychedelics and autism is that there are mental health challenges that can arise out of trying to cope with neurodiversity and the way our culture perceives neurodiversity.
Mm-hmm.
So, children who are gifted in one particular area, like
Mm-hmm.
for example, verbal processing,
Yeah.
but their other kinds of processing or their other intelligences are at the lower end of the spectrum, can have all kinds of bullying and misunderstandings and frustration from parents and so on. So what we've seen, there was one study that was done at UCLA of social anxiety in people who are dealing with autism, and they found that it was actually helpful for social
Mm-hmm.
anxiety. But I would not say that these compounds treat directly. It won't make someone with neurodiversity not neurodiverse, if that makes
Mm-hmm.
sense. At least
Okay.
so far, I haven't seen that.
Okay. So mostly it helps dealing with like social anxiety or the mental health problem instead of like dealing with direct maybe ADHD or autism or dyslexia or whatever like this.
Exactly.
Okay. Yeah, makes sense. So what also I wanted to ask that that these especially we've been discussing that these psychedelics are there, but of course there are some risk
Yes.
attached to it. So what are the risks? I would say, what are the risks associated with psychedelics?
It's really important to talk about this, that these experiences are not for everyone. And in particular, people who have a fragile sense of who they are. And I would include, for example, people who have been diagnosed with schizophrenia.
Mhm.
It seems likely that would be very risky for them to
Mhm.
consume a psychedelic compound.
Mhm.
There have been plenty of cases of people who are in that kind of maybe age 17 or 18 to maybe age 24, that risk period where people may have a first psychotic break experience. People who had not had a psychotic break before, but then consumed LSD and had psychosis that lasted for years afterward.
Mhm.
So it's dangerous for people with a family history, I would say, of
Mhm.
psychotic disorders, or someone who might be in a prodrome for schizophrenia, for example.
Mhm. Mhm.
Um, and then, so mostly what we're dealing with is psychological risks.
Mhm.
And again, taking a psychedelic in a non-clinical environment or a social context or at a music festival or something like that,
Mhm.
people can often have very difficult experiences uh,
Yeah.
because the compound it amplifies what is inside of you. And if you don't have
Mhm.
a supportive environment to process that, it can be quite traumatic, actually. Um,
Yeah.
there's also concern about bipolar disorder,
Mhm.
particularly with MDMA, because
Yeah.
MDMA stimulates such a big release of catecholamines, not just serotonin, but also dopamine and norepinephrine. Um,
Mhm.
all of these concerns go into a really thorough medical evaluation prior to
Yeah.
recommending something like this. And then there are other physiological or physical side effects like increases in blood pressure and heart rate.
Mhm.
Um,
Mhm.
and so, someone with uncontrolled hypertension, for example, probably should be on a blood pressure medicine before taking a psychedelic, and so on.
Yeah. 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 That's true. But as we were discussing that in ancient times also the people used to take it. So can these psychedelics be used by normal people just to induce certain kind of maybe heightened state of consciousness?
Well, there's plenty of recent history as well in that area. Uh, it'd be difficult to find a jazz musician, for example, who hasn't used psychedelic drugs to help with creativity.
Yeah.
There are a wide number of scientific researchers.
Mhm.
The people who discovered the double helix of DNA credited LSD as helping them. It led to the Nobel Prize. The person who discovered PCR, which is a technology for mapping DNA. Again,
Mhm.
the person who did that got the Nobel Prize for that, said it was because of psychedelics that helped them find that. And Steve Jobs and so many other innovative,
Mhm.
creative people. So it absolutely can help with
Mhm.
creativity. Um, there's a whole movement around people using very, very, very small doses called microdoses of psychedelics
Mhm.
for
Mhm.
creativity. So I'm not sure that people have to have a giant dose of a psychedelic to
Yeah.
specifically help with that aspect. Yeah.
Yeah. Yeah. That's very interesting that how um, these drugs can induce like creativity and all these things, and it's been like used not only as we discussed, it's been used since like many years, like from the ancient history as well, like Egyptian people or maybe
Yeah.
like even before that. So lots of people are using these kind of herbs to stay ahead of other people or to maybe connect with some kind of other experiences of consciousness. But I think as you also mentioned that these kind of experience can also be induced without these drugs as well. So
Absolutely.
this is interesting, very interesting. Just before we actually, because I know that this is such a fascinating topic that I can discuss on and on and on, because I have lots and lots of questions about it. But before we actually close this show, I want to ask that does this like these taking these kind of psychedelics make you addicted or something, or like is this kind of like the other drugs like the marijuana or something? They get addicted to it. So it is like that, or it's okay to have micro dose and then leave it.
Great question. I think it varies from one compound to another. We certainly do see people getting addicted to ketamine. Ketamine is used as a party drug socially.
Mhm, mhm,
Um, I know people from New York who say that at the end of the party, someone comes out with a tray of ketamine and people do it together. I think mostly to maybe escape ordinary consciousness,
mhm,
not for a healing purpose.
mhm,
And tolerance and dependence on ketamine happens, absolutely does happen. The other compounds, the other psychedelics, are not associated with addiction. So
mhm,
people who use, for example, psilocybin might use it a few times for
mhm,
and find benefits to it. But what tends to happen is over time, people use less and less of the
mhm,
traditional psychedelics, as
mhm,
opposed to more and more. So it
mhm.
doesn't. It's very different from marijuana or cocaine or heroin or
Mhm,
some of the other
mhm,
Schedule One drugs.
mhm. All right. Yeah.
Yeah.
You have the mission to actually train like 10,000, I think, people to professionals to actually on psychedelics. Why does it matter to you?
Well, I've always. It seems like it's part of my personality to want to try to leave the world a better place than how I found it. And as I mentioned in the beginning, the tools that I was trained to provide in my medical training just didn't help enough people. Um,
Mhm,
I've had the privilege to sit in traditional ceremonies. For example, in the Native American Church in North
mhm,
America, and
mhm,
also in ayahuasca communities in South America. And I've
mhm,
experienced healing in myself that was very profound. I've
mhm,
also taken advantage of modern tools like somatic psychotherapy to
mhm,
address my own childhood traumas.
mhm.
But there are things that I talked about with my therapist in ordinary consciousness that we could never get underneath without the support of psychedelic therapy.
Mhm.
So it's um, it's a personal mission to do what I can with the
Yeah.
decades that I have left, and you never know how much time you have left. But I want to do the best I can to deliver the biggest change I can.
Yeah, absolutely. It's wonderful that you've been helping so many people to deal with their own traumas and live a better life. So you're doing a great job. I know this. You're making this world a better place, definitely. So thank you so much for joining. Before we actually close the show, tell us what is the best way to reach out to you.
Well, thank you. The best way to reach out to me is uh, I would encourage people to visit our website, the
Okay. Yeah.
psychiatryinstitute.com.
Okay. Yeah.
Oh, thanks. It's in the crawler at the
Yeah.
bottom. And you can learn about our programs there. We train people from all over the world, not just North American people.
Mhm.
And yeah, you can reach out to me through the website. So thank you
Okay.
for having me.
Okay. That's great. So whoever wants to heal their traumas or need some help from Will, please go into this website, Psychiatry Institute. It's also uh, I've put this the link of this website in the comment as well, and this is the link to his LinkedIn. And I think you're also very active on social media, or like on Insta or any other social media. Are you there?
Uh, I have social anxiety with that, but I do have accounts.
Yeah, that's a good one. So
That's another
that's it.
story. Yeah.
Okay. Okay. So I think the best way is to reach out to the website, and Thank you so much for sharing your wisdom, your insight. It's a fascinating topic. It's always like intrigues me to find out more about it, that how it just changes everything by taking something.
Mm,
And it is like, as we discussed, that it is basically it's been used since thousands of years. It's not just for the
thousands.
first time, but again, there are risks involved. So it's very important to have some mentor, some guide, some doctor
Yeah.
who actually know, who's well trained on this. And
Yeah.
of course, you are very well trained. So please get in touch with Will if you need any help. And thank you so much for joining. And I know lots of people are actually, I think, sharing more comments, and I was not getting it. I think only from the LinkedIn I was getting. But there are other media. I'll just uh, respond to those comments later on after this show.
Okay,
So
great.
thanks to all those who joined from either like they're listening live or they're joining it as a recording. Oh, one more thing before to our audience. It's not related to Will, but it's basically I want to remind all the audience that we are planning the summit, the International Symposium on Education on Saturday. So please register yourself because it's just only 2 days left, and avail this opportunity to learn uh, from the global experts who are doing innovative work in education. So please, I have shared this also, shared the link in the comments. Please register and avail this opportunity. Thank you so much and have a great day. Bye.
Thank you so much.
Yeah.